Welcome, everybody, to the Mental Health Action Partnership learning session called Mental Health Gets My Vote. And this is tips and tools for engaging candidates. This is hosted by MHAP, the Mental Health Action Partnership, which is a statewide mental health coalition gathered to advance mental health system improvement throughout the state and across the continuum of care and across the lifespan. You're welcome to check out MHAP's priorities. We do our work in work groups, and anyone is welcome to join a work group. So I'm just going to put the website in the chat here, and you can check us out. But now to our topic today. One glance at the headlines, and you'll know that we're in the thick of campaign season. And it's been, it's been kind of a do-si-do, hasn't it, right? So the stakes are very high, especially for the governor's race and the state legislature. And between the upcoming primary on August 11th and the general election in November is one of the best times to educate candidates while they're asking for a vote. We can help raise their awareness about mental health issues, what we need, what's working, what we want from them when they're elected. They're listening to us. This is the time when we can engage. But many of us are in nonprofit organizations, whether we're a staff member or board member or simply a member, and our face is the face of a nonprofit organization. So we might hesitate to get involved in advocacy during election season because we're a bit fuzzy on what we can do and can't do without overreaching our nonprofit status. So our goals today are to help you feel confident about engaging candidates by understanding the do's and don'ts of nonprofit advocacy, by learning tips and tricks to be effective, and we'll also share resources that'll help you communicate the issues. So that's why I'm thrilled to introduce our presenter today, who can address election season advocacy from multiple angles. Richelle Andrae is the Associate Director of Government Relations for the Wisconsin Primary Health Care Association. They're the folks that run the federally qualified health clinics throughout the state. They do, the whole array of medical health services, including behavioral health. She is also an elected official serving as the Dane County Board Supervisor for District 11 on the west side of Madison. So Richelle is going to share her wisdom and expertise based on both her experience as a nonprofit lobbyist and also as an elected official. So before we start, I want to note that this session is simply for your information. We're not providing CEUs. We did have questions at a previous session and people were disappointed, but we're just putting this out here for you to use, everybody. Also, this session, as you can tell, is being recorded and it'll be available on the MHAP website for you to look at and to share with others. So a little bit about here's how the session's going to go. While Richelle presents, feel free to enter questions and thoughts in the chat. This goes without saying, but especially when it comes to politics, keep it nonpartisan and keep it respectful. And we'll monitor the chat and answer brief questions at a few points, but then we'll keep the more complex questions for the discussion at the end. We're also going to ask polling questions at a couple of points and use those results as a springboard for conversation. So during the discussions, at the end, you can use the chat, you can raise your Zoom hand. If we get too many people on the call, it really doesn't help to raise your physical hand because we can't see you. So either chat or use your Zoom hand. So with those round rules, I'm going to turn it over to Richelle.
Wonderful. Thank you so much, Sita. Thank you, NAMI and MHAP, for inviting me in today. I'm really excited to have some time with all of you. I know you could be doing anything today. You could be, working with a client, improving a program, doing big picture thinking, but you're spending an hour or maybe an hour and a half on this topic of candidate engagement. So thank you for prioritizing that in your really, really busy plates. It's an essential role, I think, of anyone working in the behavioral health setting, whatever that is. I do see we also have a handful of folks with experience in county government, county human services, behavioral health. Thank you in my role as an elected official for the work that you're doing every day. We're not going to get so far down the rabbit hole on what advocacy or education looks like as a local government official. Those are kind of more questions for your corporation counsel and your organization. But if you do want to go down that road, I encourage it to make sure you know if and how you can engage in your role as a county member of service too. So here we go, just getting started. I will be addressing a handful of different topics today. And if we were a smaller group, we would really look for some small group engagement, but we're just going to use our polling features, as Sita noted, talk about some do's and don'ts. I will go into more of the rules and regulations about advocacy and more particularly lobbying at the state level, just so that you know what you maybe don't know and where the lines are. Some tips on maintaining your role as a nonpartisan educator or advocate. I also field a lot of questions from the community health centers that I work with, or the FQHCs, about how do I figure out if this is me doing the work or am I doing that work on behalf of my organization? So we'll have some discussion there. And then some tips and tricks on engagement. And then finally, resources, and we'll walk through a few of those together. I also want to acknowledge that many of you on the call today probably already have a lot of robust skills in this area, and that maybe we have different approaches. That's part of what makes advocacy and education with policymakers so exciting, is that we can each bring our unique skill sets, our own perspectives, and a different approach. Just the way I do it doesn't work for everyone, and I'm constantly evolving that for different settings and people I'm working with too. So I encourage you all to share your own experiences, your own insights along the way. I am not the only subject matter expert on this call. So just to get us started, Julia, if you could launch our very first poll, I would love to know what comes to mind when you hear the word advocacy, and have you engaged with candidates before? You should see that Zoom poll pop up. We'll give you about 30 seconds to add a word or phrase into question 1 and answer question 2. Have you engaged with advocates before? Yes, in the last year. Yes, past election cycles, or no, but excited. All right, wrap up those responses and we'll go ahead and share the poll out. Julia, when you think we've got a good response rate? Okay, let's go ahead and share results. Julia, can we see the short answers to the question too?
I thought you would, but if not, I can put a link where everyone can see it, I believe.
Awesome. Maybe I just don't see them if I didn't answer the poll myself, which is possible.
Well, here, looking at the results to the what comes to mind when you think of the word advocacy? We've got voice, lobbying, working on behalf of someone else to make a change, educating legislators about real changes they can make, using your voice to speak up for those that may need their voice heard, voice for the voiceless. I see that coming up a lot. Educate and persuade, a lot about education, empowerment. This is fun. There's a result that says lobbying, and the next person said not lobbying. And yeah, a lot about education, a lot about voices. And then it looks like we've got about a third of folks have engaged with candidates already this year, which is fabulous. About a third have done so in past election cycles. And then we've got just under a third of folks who haven't, but are excited to learn more.
Wonderful. This is indeed a great launch pad for us. I'm somewhat overjoyed that no one, made references to, old guys sitting in rooms smoking cigars, throwing money around. I think that's often maybe something folks come up with more on the lobbying side, perhaps. But this is a great place for us to start. So just in terms of a little bit of background on who I am, my role in the space of anything advocacy and policy, I do work for WIPCA, which is the Association for the Federally Qualified Health Centers, FQHCs, or community health centers in the state. So you may be familiar with some of them, maybe in your own local area. If you're in the Madison area, that'd be Access Community Health Center. I know we've got some Racine folks, so there's 2 FQHCs in Racine now, and then a lot of sites in rural areas across the whole state. They primarily provide preventative care, medical, behavioral health, and dental services to Medicaid and uninsured patients. So I'm often talking about the lens of the safety net, access to preventative care, and trying to maybe bust apart some assumptions or narratives about why access to preventative and primary care is challenging for many folks in the state, because policymakers may not, or perhaps had that experience themselves. And it's part of my role to provide that real experience of patients across the state as much as possible, and to share that story about the role of community health centers. And I do see a question in the chat about slides. These will absolutely be available, and there are lots of resources linked in them that you would be able to access afterwards. So the role at WIPCA here, we are the association for all the 18 federally qualified health centers. We provide training, technical assistance. I am our registered lobbyist. I do our state lobbying work on behalf of all the health centers in the state. None of them have lobbyists, so I'm really that voice in trying to elevate their issues and message, though many health centers also engage in advocacy and education. And often what I'm doing is connecting those dots between clinics, policymakers, what's going on in Medicaid, et cetera. And I certainly want you to know that there is no one particular road to policy or advocacy work. This is my road to the world of policy and advocacy. And there is no right or wrong way to get there. And if it's a side hustle and something you're doing as a part of your role or in addition to your actual professional work, I really have the privilege of spending all of my time, both in my day job and my night job, on policy and advocacy, but I know that's not the case for everyone. But I did work directly with kiddos and families for my career before going back to grad school, which was in a public policy role. I definitely didn't envision being in a lobbying space though. But in 2020, I ran for local office and I started my job here at WIPCA as our government relations lead. I've been elected, this is now my 4th term on the county board, and that could certainly be a full-time job if I had enough resources to dedicate to it. Most recently, I've chaired the committee that has oversight for all of the justice departments within the county, so I also saw someone involved in treatment court on the line. Thank you for your work, which is so essential. And I think a lot of people get into the space from the politics and campaign world. I come from most recently the state health department and within the bowels of Medicaid, where I was a policy nerd, and I'm applying those policy skills into the advocacy and lobbying space. And then I'll also share, throughout the presentation here, a few examples from county board when I have been lobbied, or I can tell someone is trying to influence my perspective on something, and sharing how people do that in ways that have varying degrees of effectiveness. So just to get us started, advocacy is really an umbrella term. So underneath the umbrella of advocacy, there is a very specific definition of direct lobbying. And this is something that's actually defined under state law and in other areas of statute. But direct lobbying is 3 things. It is expressing a position on a specific public policy topic, like a bill or a regulation, and asking for a policymaker to support or oppose your own position. So that is very specific, and it must have those three components. Now, there's a lot of gray areas to all three of those issues, but that is what direct lobbying actually is under state law. Grassroots lobbying, on the other hand, is much more generalized, and it's often like messaging to the public or a constituency of your organization that they should take action or generally support or oppose some sort of a policy. So that's more on the grassroots lobbying side of things. We may also hear reference to grass tops. So that's engaging maybe the executives of organizations and asking them to take a position and work with their policymakers on something. But those are different categories under state law. Under the advocacy umbrella, I would also suggest that voter registration and civic engagement efforts, like maybe getting patients or the folks you serve registered to vote, or holding a candidate forum, those are civic engagement areas of the advocacy space. And then providing education and information is most likely what people are doing, like me or other folks in the Capitol or any of your organizations or the clinics that I work for. I would say most of what I'm doing 80% of the time is actually education and information sharing. It's here's how this bill might impact my clients, my patients, our community. I want you to know that. It's educating about the trade-offs or the issues or providing information, not necessarily saying this bill is bad, we oppose it, we want you to also. That would be in the direct lobbying category. So again, just the groundwork on nonprofit work in the policy and advocacy space. Nonprofits are allowed to engage in educational advocacy. So that's great. Oftentimes people think that nonprofits can't do that at all. Nonprofits are also permitted to lobby under the technical direct lobbying framework. So I work for a nonprofit. I am our lobbyist. And so we do lobbying activities. Nonprofits are indeed also allowed to engage in nonpartisan voter registration efforts. Now, there are, for example, some proposals at the federal government that would restrict federal grantees from doing any voter registration efforts with your federal funds. That's a proposal that the administration is currently advancing through the regulatory process, but that's not so much about nonprofit rules and requirements. It's much more about what the terms are of federal grants, for example, that you may or may not receive at your organization. But nonprofits certainly can do voter registration work. On the other hand, nonprofits as your organization cannot endorse or donate to candidates. That is strictly prohibited by the IRS. During business operations, staff cannot be talking to patients about particular positions on candidates or saying, vote for this person or don't vote for that person. Those would be prohibited activities. Now, you can do that in your role as a human outside of your work responsibilities and outside of your formal representation of your organization, certainly, but not on behalf of your organization. And nonprofits cannot use federal funds for lobbying efforts. So even though I work for a nonprofit and we receive federal funding on 2 big federal grants, we cannot use the funding through those federal grants for any of my lobbying activities. You would have to use other dollars. So for example, we have membership dues, and part of those membership dues support my role, my activities in lobbying. But you can use lobbying or federal dollars for educational purposes, again, just based on the terms of your federal grant and other ways that your organization deals with revenue and expenses. So do want to delineate all of those. Basically, if it's political activity, which is defined under various laws, nonprofits cannot engage in political activity, so like campaign activity. I had a fascinating example, though, just last week where a candidate for governor reached out to one of the nonprofit organizations that I work for, and that candidate said, I would like to hold an event at your organization. I am also your current state senator, may I hold a campaign event there and educate the community about an issue I'm working on in my campaign? That's a little bit more of a gray area. And we could talk about more specific examples like that in the future, because it was not the organization itself engaging in political activity. It was a candidate who wanted to do campaign work on site. But that candidate, for example, would not be allowed to collect signatures for qualifying for the ballot at your healthcare organization. That would be a prohibited activity because you're hosting what is political activity. But there's a lot of gray areas too. For nonprofits that are interested in lobbying, you may not spend more than a substantial amount of time on lobbying. Courts have gotten involved in defining what substantial time is, and it's generally thought of as 5% of your total time and expenses. Now, most organizations, if you've got any more than a handful of staff, if someone is even spending maybe 10% of their time on actual lobbying, you would be nowhere near those limits. So it's really, if your organization is spending significant resources on any lobbying efforts, that you would be getting in trouble. And again, that would be with the IRS, but you may not do campaign activities or political work. But that is kind of what the test is of 5% on lobbying. So even though I'm a full-time lobbyist, only a small percentage of my time is actually direct lobbying. Most of it is education and advocacy. So we're also nowhere near hitting any of those 5% thresholds. There are also statutory requirements about lobbying in Wisconsin. So if your organization or an individual is actually lobbying, it means something in particular, and there are various requirements about what you must do if you hit that threshold. The technical threshold under state law is that you must register as a lobbying organization if you or your organization, and this is what it says under statute, attempt to influence legislative or administrative action by oral or written communication with any elective state official agency or employee more than 4 times in a 6-month period. So those are the rules. You're probably not doing that. And if you were, let's say, on behalf of your organization, you reached out every week for the last year to tell your state lawmakers to pass Medicaid postpartum coverage, that actually would be meeting this requirement because you're doing it often on the same thing and taking a position on it. But if you are given a phone call to your local elected official occasionally, either on your own time or on behalf of your organization, to tell them about the great work you're doing and encourage them to come by for a visit, or say, hey, why aren't you investing more in behavioral health and substance use care in the state? Those things are much more generalized and nothing related to what is required under the state lobbying rules. But organizations that do this a lot need to think about registering as lobbyists. I'm starting to see some fantastic questions in the chat, some of which are a little bit complicated, but keep them coming, and then I want to circle back to them. And some of them are also going to be a little bit beyond me, because nonprofit and board of directors is also a really good question. So I want to circle back on some of those. These are prohibited activities. Again, these slides are available for your reference, but prohibited: no endorsements, no fundraisers at your organization for sure. We're going to talk later about having visits from candidates. I would actually recommend doing that as an educational, non-lobbying effort. It's something that organizations can do to inform a candidate about issues, hear from them, get to know them better. Those sorts of activities are very allowable. You can't cross that substantial threshold, 5%, can't use federal funds. I would not put yard signs on your organization's property for any particular candidates or political, I can't think of what a different example would be, but no candidate signs. You also wouldn't want to put like a Democratic Socialists of Wisconsin sign out, or Republican Party only patient, those sorts of things that are much more partisan would not be permissible. And then minimal and restricted efforts here, and then in blue, and then encouraged activities for nonprofits. There are many more resources about all of this from the IRS and some other agencies that summarize rules and regulations, so they're linked here. I do want to go back to the chat then at the end of this section. So let me see. As a private citizen, great question, Rick. Is it okay to educate a legislative staff about an issue by sharing examples of legislation from other states? Absolutely. As a private citizen, that would be something great to do. I might also suggest that doing that also on behalf of your organization, if that's something your organization is okay with, is also great as long as it is educating and sharing information about issues, really where you're jeopardizing any of your kind of political nonpartisanship status is about encouraging action or taking positions. But something like sharing examples of state legislation in other areas, definitely recommended, either as private or organizational representative, again, if that's okay for your organization. How to handle a candidate taking a tour of your facility. We'll talk more a little bit about that later. But I think a lot of it is about you as an organization setting the guardrails and the expectations for what that looks like, and about also inviting other candidates is one of the key tips there, is that if you talk to a candidate from one side of the aisle, you should also be inviting all of the other candidates, either from that party or the whole range, to have the same opportunity to engage with you. That's sort of the number one thing to do to maintain nonpartisanship, is offer the opportunity equally to all candidates involved that are in your area. And Mariana's question, when I say nonprofits, does that include individuals serving on the board of directors as well as employees? You know, I am not so well versed in kind of the role of the board of directors relative to different types of organizations. I know a lot about that for FQHCs in particular, but whether they're officers and kind of what authorities they have, I don't actually feel like I can answer that question for you. But if anyone else in the room here would like to do so, please go ahead and dive in the chat. What I would say is that when I work with clinics, we do educate and train their boards to be engaged in advocacy and policy work on behalf of their organizations. And it's mostly a matter of coordinating that internally at the organization to figure out who's got what role and kind of what's appropriate, what the needs are. And in addition to laws and rules about policy and lobbying, a lot of this always also comes down to perception. So even though maybe as a CEO of your organization or as a staff person or as a board member, sure, you've got a private role as a citizen out in the world to put a yard sign up at your own home, not at the organization itself. But you may want to be mindful that as a representative of that organization, it also has a role in how someone perceives your organization. So, you know, I do suggest that the CEOs of our organizations don't put yard signs out and, you know, even at their own home, just because it might reflect back on the organization if you're a leader there. But I think that's something every single person needs to evaluate for themselves and their organization, and kind of your environment really matters a lot. I see a great question. If a group of grassroots advocates is advocating for a bill and they meet with 5 legislators, do all the advocates need to register as lobbyists? Well, it's only if they do that and hit that number of times within a certain period threshold. So it's not just once, it's more than 4 times in a 6-month reporting period. So if any individual does hit that threshold, technically you would need to be registering as an independent lobbyist. Now, I bet most people in Wisconsin do not actually do that, but technically that's what the law says. And who's ever going to find out if you're doing that? Like, there's no way to track that, but it would technically be a violation of state law if you meet that threshold and are not registered as a lobbyist, as an independent person. But most people who are registered as lobbyists do that on behalf of an organization they work for, or maybe are contracted to work for. Great question. Should there be a board policy to determine who can lobby for your organization, or what might that look like? Having a policy on this topic is really helpful for clarity. Who can say what and when and with what permissions, that often gets really, really complicated. And having a policy about it and having that go through your board is a great idea, because it kind of brings up some of these conversations and kind of also force the question on who's okay to do what. If any organization here has a sample policy, maybe share that with the group. The groups that I work for do indeed put like resolutions to their board forward about advocacy, and then also have certain individuals in their organizations that are basically approved to speak on the organization's behalf, like for media, not just for policy and advocacy, but for media purposes. So it's good to know who that is and kind of have a good sense of it. And maybe it's just your leadership team or C-suite, whatever that looks like, or maybe it's, maybe your board of the director of your board, or, another official. But I think that looks different for every organization and could determine who, when, why, and what the approvals are, maybe what the issues are that would be appropriate to educate on behalf of your organization. Just like you might have a social media policy about what someone can and cannot say on social media, and if that reflects on the organization, etc. So advocacy strategies certainly look different in lots of different settings, but here's some examples of advocacy in real life. The occasional email like, hey, I saw this bill is moving through the process, or the budget is coming up, please consider more funding for qualified treatment trainees, QTTs. That's really important to me. Going to your local government and testifying or sharing an email about something that is challenging about the contracting process, or again, a budget initiative. Contacting a lawmaker and inviting them to do a tour of your organization, again, as an educational opportunity, great idea. Either of a current lawmaker or of a candidate. Current lawmakers are safer because they are currently your representatives and have a role in representing your interests in the state capitol or in local government. A lot of organizations have like a day at the Capitol, something where a whole group of people is going around and educating everyone about similar issues. So that's an excellent way to engage. Protest. I'm in Madison, so we're really experiencing a lot of important protests right now because of the police-involved shooting a week ago. And I certainly see that as an essential advocacy role, and one not to be taken lightly, and relative to protecting democratic freedoms, small d, democracy. And then even talking about the issues on social media or drawing attention to policy issues or candidates, great way to engage and share information. If you're in this room here, you're probably aware there's an election coming up on August 11th, but it turns out that most people in Wisconsin still do not know that's even the case, and people are just starting to pay attention now. Excuse me. Here's just a sample meeting agenda if you would like to host a candidate or a lawmaker at your healthcare organization. Making sure that you're doing the outreach in advance to say, we are a nonprofit, we don't conduct any political activity, we would love to educate and inform you about the issues. That way you're also signaling, where those lines are for your own benefit and for the benefit of the person you want to come visit. You might have a little clinic tour, make sure that you're prepared for that. There might be people in your clinic that needs a heads up about that. Maybe you have masking requirements at your organization. Those should be relayed proactively. I had an issue during COVID where I thought it was pretty common knowledge that we would have masking requirements at the healthcare organization at that time. And we had a wonderful lawmaker come for a visit and say, oh my gosh, I cannot proceed with the clinic tour because of your masking requirements. I've made my position known on those requirements, so I can't come. And it was a very awkward lesson learned for me about not communicating that proactively. So making sure that you're sort of mitigating any of those things in advance and kind of giving folks a clear idea of what you're trying to accomplish during that meeting. And then time for a discussion to really just sit down and talk through some of the issues. And hopefully you're bringing the right people to the table based on what you're trying to educate that policymaker about. But if it's maybe a payment issue, having your billing staff or a CFO involved. If it's maybe a patient who has some training in how to engage with policymakers or has a wonderful story to share, that you prep a little bit for how to share that story effectively. Maybe it's someone who is a community partner trying to start a new program with you and address a local care gap. Think about how you put those pieces together in a way that's strategic relative to whatever goals you're trying to accomplish in the meeting. Always take a photo with the permission of whoever is visiting. It's good to share and help people understand the work that you're doing. And thinking about patient privacy considerations, so you probably don't want to go into a space where people are actively receiving care. So doing that maybe over the lunch hour or before or after, if your clinic operates actual patient care would be recommended, or at least kind of navigating into spaces where patients are not being exposed to having a politician walk through while they're getting their teeth cleaned, for example. I do see a question in the chat about C4s. I am not going to address anything C4 today because I am not involved in a C4 and I do not want to send anyone down the wrong road on C4 requirements. They are very, very different from C3s. So if that is something your organization has, hopefully you have an attorney to walk through all of those differences for you. I think another area to keep in mind when you are engaging with local or state elected officials is to think about whatever issue you're trying to engage on. For this group, it's probably mental health, behavioral health, SUD treatment, kind of human services related work, and at least having a sense of what is within the authority of the person that you're meeting with, or what level of government has oversight there. And for many of the issues that we will talk about, it's very complicated. Counties administer services, with authority from the state and the federal government. But I do think that often, going through that process to make sure that whoever you're talking to kind of knows the big picture, but knows where their lane is to make change in that big picture. Like if it's a state elected official in the legislature, excuse me, state budget stuff, things that Medicaid has oversight for, programs they could fund are great areas of work and discussion with that lawmaker. If it is the nuances of a contracting issue between a local provider of services and the county human services department, probably not the best use of time with a state lawmaker to talk about that issue. Maybe you want to still educate them. Maybe there's something relevant for them. But kind of matching who's got the power about the thing with the thing is pretty essential. Also thinking about who else might be a strong resource for you on that topic, like a community partner where you can really collaborate together to bring different perspectives, I think is even more effective. It's hard sometimes to get a policymaker's attention as a lone advocate working in a silo on that thing, and to show that you're part of a broader network or a group, even if it's a loosely affiliated group of people. We're getting together for coffee, the first Friday of the month. We've been talking about this issue a lot, kind of showing that it's got some scale and some scope can really be helpful. I've got a few examples here where an actual, patient example. This was a really tragic situation where a college student went to go get his albuterol inhaler refilled. He's got asthma like I do, so this one really hit close to home. Went to go get his inhaler refilled, and the pharmacy said, that's not covered under your benefit anymore. We can't fill it. And the college kid, not really knowing his insurance coverage or whatever it was that well, which is not surprising. Most people don't. Not just college students, it's hard to navigate. That student went to, go get it filled and left without his inhaler and had an asthma attack the next day and died as a result of that asthma attack. And his family is, of course, beside themselves, but has turned that into a massive advocacy campaign about pharmacy benefit managers. These are middlemen between insurance companies and drug benefit. So that insurance company had changed which albuterol inhaler was covered. There was not a good conversation at the pharmacy about the alternative that would be available for the student. And now that family is trying to drastically overhaul pharmacy benefit manager and kind of pharmacy access issues in the state, and have built a whole community around this topic. So they're not just like a lone wolf going into the Capitol trying to convince people it's an issue, which of course it is for their family, but they're really bringing people together who have had different experiences about this and can really put a lot of different faces to that experience. Also a great example from earlier this spring, where a mom and her family experienced a barrier to accessing breast cancer screenings. This mom actually was very, very involved with multiple advocacy efforts in the state. First, to actually get a notification on your screening if you have dense breast tissue. So first she got that bill done because she didn't know she had dense breast tissue. So she didn't know she should be asking follow-up questions. She didn't know that there were supplemental screenings that maybe she should be alerted to. So first she got that done. And then unfortunately, this mom eventually died from breast cancer, but her family has continued her legacy and now got Gale's Law passed in March of this year, which requires supplemental breast screenings to occur when clinically indicated with no cost sharing for the patient. So they must be fully free out of pocket for both commercial insurance and Medicaid. Medicaid already went into effect. Commercial insurance will go into effect next year. But basically, this was a family that said thousands of women in Wisconsin, and men, may have had this experience. Let's track them all down. And they built a whole network of people about this issue of supplemental breast cancer screening. So really a success to show that there's force in numbers and that over time, people can get stuff done when you're not alone. It's hard to do things alone. These are some of the types of advocacy campaigns that I work on. For example, you don't have to, do it all in person or over the phone, but we had more than 1,400, it's a little bit higher number now, actions last year about Medicaid advocacy, and that included, you can see the CEO from one of the clinics that I work with handing over a stack of things to a staffer out in Washington, D.C. that were all patient testimonials. So we had patients in the clinic just saying, I love Medicaid because, a single word on a piece of paper. So it was in that one, it helps my family get preventative care. It keeps me out of the emergency room. I can go back to school because I don't have tooth pain. So we took that stack of things. Now, it's always hard to say whether that had any immediate effect, but it was powerful for the patients to complete them. And it was powerful for the clinic staff to say, I'm not just making it up. People really need their Medicaid coverage. And here's why. Here's proof. I'm going to show you to try to really build that story. Now, that was during a time that was really contentious in the U.S. Capitol that resulted in work requirements in the Medicaid program, which will be going into effect next year. But there were changes along the way in that process as this bill was working through the Capitol and all kinds of committees that actually, you may be surprised to know, kind of ratcheted back some of the very, very, very worst provisions from when that bill started. So for example, there's going to be no co-pays for any care that's provided in the setting for the clinics that I work for, which is positive because this is primary care. Which is really important to keep people healthy on the front end and, ideally bend the cost curve a little bit. But things change along the process, and there are lots of different kind of places in that trajectory of a bill or whatever it is as it moves along. So it's not always just about yes or no. It's about make this less bad or make it a little bit better or, come back and take another kick at this can later. At a local level, I would share my experience that you may have heard of Flock Cameras. This is a big, national for-profit company that has really had a corner on the market for video surveillance for law enforcement. And often, maybe the reasons that these cameras are used are positive, like finding a missing person. There's all kinds of Amber Alerts, things like that are more effectively addressed through some of these cameras. But there are major privacy security concerns about the cameras too. And then this company in particular has done some really oppressive things with data, and we could have a whole conversation about that another time, but there was essentially like 10 advocates here at the local level in Dane County who put their foot down, organized extensively around this issue, came to every committee hearing, emailed us very helpful information, organized learning sessions, found alternatives. And I would say that group of 10 people, I could probably name them, was really effective in changing the entire landscape on these cameras in Dane County. So all the cameras were taken down. We ended the contract with them. We have a much more transparent process about looking at a different vendor for all of this. So my message here is that a small group of people can really, really make an impact at the local level if your local government has authority over the things you're trying to change, which isn't always the case. But oftentimes your local officials are also a bridge to your other officials. So there's always kind of connections and opportunities to explore. A few tips and tricks. Number one, I would say know your audience. Go into a meeting, and I know you can't spend all day doing this, but go into a meeting with a little bit of sense of who you're meeting with, what they care about, and can you find a way to connect what you care about to what they care about? And there's probably something there. Maybe you assume that you wouldn't agree on anything, but I'm willing to bet that probably the goals might be the same, but maybe the way you each think about getting at those goals might be different, but kind of keeping your focus on what you're trying to accomplish can oftentimes be really helpful. And figuring out, as much as you can, what motivates that person. And is it data? Is it stories? Is it a local problem they've been trying to deal with? Is it, a committee that they're on? And a lot of that context is public, and even reading through someone's campaign website or their official website, if they're a state lawmaker, you can learn a lot about what they care about. For me as a local official in Dane County, if you read my local bio on our website, you would see that I have a dog. I use county parks. I like to kayak. I, grew up in the Milwaukee area. I lived abroad. There's probably some things there that tell you a little bit about my beliefs and maybe a way to connect on maybe a more of a personal level. Having some context for the issue that you're working on, if it's a brand new problem, if it's been coming up for a long time, anything you can understand about who the other players are is helpful. I think being clear about what your value and what you're bringing to the conversation, just as sort of a thought exercise, can be really helpful. What do you add? Is it your experience as a clinician? Is it trying to balance the books at your organization and knowing that you can't do that unless some of the funding changes? A patient that you met with whose story you can really relay, with their permission appropriately to someone else. So kind of thinking through what you want to accomplish and what you bring into that role. And then a reminder that so many efforts take patience. I know that is at a premium these days. I'm feeling extra impatient too. But knowing that one conversation is probably not going to change anything, I'll speak for myself. I can't think of many conversations where in 5 or 10 minutes I totally changed my mind on an issue, but I can certainly think of issues where someone helped me see the issue differently over time, or where multiple inputs all led me to a different conclusion. So thinking about kind of where you're at in that trajectory of your patient process trying to get something done. And just knowing that, like, for multiple of the issues I just discussed, that pharmacy benefit manager issue and the one on Gale's Law, those were efforts that are more than 10 years in the making on both of them. And I know that's hard when there are urgent issues right in front of you today, but the context helps me at least feel motivated. Otherwise, staying on topic, it can be really easy just to go down a whole bunch of different rabbit holes, but you probably just got a half hour or so with someone and trying to stay on that topic, figure out, what the personal connection is to the issue. I do often see advocates or, folks who are trying to educate a policymaker about something, just talk and talk and talk. And of course, your perspective is very, very important, but you don't know if you're losing the person on the other side. Maybe they already know everything that you're saying. Maybe they just heard it in a meeting right beforehand. So stop and listen, ask questions, ask is this something that you're familiar with before? Have you heard about this issue? Is this new to you? Have you been hearing about this on the campaign trail? Is it not coming up? Get into dialogue as much as possible. People will remember those conversations much more than just being talked at. Which, to be fair, is what I'm doing to you all today. So hopefully you'll give me a little bit of grace. And even if you don't have an like an actual ask during the meeting, like sign that bill or don't do that. Offer your expertise. I'm here as a resource for you in the future is a great way to conclude a meeting, or, asking permission to take a photo, inviting them back. Hey, we talked a lot about, our workforce challenges. Could we set up a meeting in the future actually with the county health department too? They might be interested in talking about this with you. So have some sort of a follow-up. We could do a whole training, I suppose, on like partisan coded language, but I'll share the example. I talked with a lawmaker recently who said he's really into medical freedom. Now, I thought that's kind of surprising. I have an idea about what medical freedom is. I wonder what they think medical freedom is. And we had to first define our terms, and it was a very kind of partisan leaning way to talk about something. It's hard to know you're doing that, though, unless you're aware of it. But even thinking about like pro-life versus, other ways that people talk about reproductive care and abortions, like there are different ways these issues can be framed that are more partisan than nonpartisan. As I noted, it's good to have an ask. It's good to know maybe if your ask is something that person would never support and you have some good reasons why, maybe ask for that in a different way, or ask for a step toward that ask, or just ask for further engagement on the issue. But it is good to have a request of some kind, even if it's just, can I circle back with you on this? Or, can we meet again? Or is there anyone else that you think I should talk to about this issue? It's easy to get caught into kind of political and debatey issues, or maybe even get baited into one of those. One of my first errors as a new lobbyist was I met with a lawmaker and they said something about, care for transgender individuals. And I really had to remind myself that individual was trying to just like get me down a road on some other topic. And I was getting baited, and I really just needed to refocus on the issue I was in there to discuss, which was dental access. And that person, was really just trying to get my organization to have a position on gender affirming care. And they wanted our organization to have a public position on it. And it was just not going to be a productive conversation. And finally, it takes a little bit of thought, but have a goal in mind for your meeting, for your conversation, for the event that you're going to. Are you trying to educate? Are you trying to get them to do something? Are you trying to form a relationship? Just having that in mind can be more helpful as you kind of create a plan for your meeting. Dan is asking about having a leave behind. Always best to have something for them to walk away with, even if it's just something that's going to sit on a pile of paperwork. For some people, they're going to put it up in their office. They're going to refer to it. They're going to remember that guy gave me a thing. I think that thing had some data on it. They're probably going to file it away, maybe give it to staff if it's a current elected official. I would stray away from really long documents, but if you talk to someone and they really want to get into the weeds on something, maybe you've got a brochure about that, maybe some other, like an article you can follow up with, but having a leave behind is generally a really, really great idea, something that breaks down a complex issue or kind of lays out what some of your requests are. And MHAP has a few one-pagers like that we will direct you to. So having a leave behind is a good idea. I should put that on my list. I would also suggest that you think about how to disagree agreeably and ask yourself the question, who are the people that you like to work with? Policymakers are the same. And maybe this is kind of oversimplified, but they're probably not going to return a call from someone who was yelling at them a lot. Maybe they're not going to get right away to that one as soon as it happens. Consider how you like to be approached. It's probably by someone who is, reasonable. That might be someone who's also challenging, but is doing so in a way that invites curiosity, not that makes them shut down. Now, some people like to have a debate or a fight. I'm not one of those people. I just kind of want to talk through the issues and, hear how I can help. But try to be kind, try to be curious. You're probably going to agree more about things once you get into motivations than you might expect. And it's very acceptable to have different opinions, but trying to navigate through those toward what your shared values are is probably the best way if you're actually going to work with this person. And I have certainly seen examples where an advocate went to go meet with someone and that someone was like, I have seen you on social media. Didn't you just, rail against me, last week? And I don't know why they took the meeting, but, they were not going to work with that person because of an external interaction that was happening. You may work for an organization, if you're in any sort of human services setting. I think that either bipartisanship or nonpartisanship, which are defined a little bit differently, but both are really, really important. Because the patients that you serve, it doesn't matter if they're Democrats or Republicans or socialists or whatever these days, they deserve high quality care. They deserve access to services. And it's kind of part of your role to show that this is not really a partisan thing, even though healthcare has become very political in a lot of different ways. But what I would definitely suggest for that bipartisan approach is if a candidate reaches out to you, it's great to engage with them, but you do want to do so equally for everyone. It doesn't mean that you need to actually have the meeting with everyone, but to invite that with everyone. So what I would suggest is after, the August 11th election, what I share with the clinics I work for is that you should send everyone who wins that election in your area and any statewide candidates, especially the gubernatorial candidates, send them a letter, and the letter can say, congratulations on making it through the primary. We are your local providers of healthcare in these communities. We would love to invite you for a clinic visit and a conversation. So they're doing that with every single person that will win the August 11th election, so that they know they can check the box. We're going to talk to everyone. Everyone has the same opportunity to talk to us. Now, if a candidate reaches out to you, now you're kind of put in that position, and it's always just better to be proactive. If you have a visit or any type of engagement and you're sharing more information about that, either externally or even internally with your board of directors or in a staff newsletter, being as clear as possible that you are engaging with those people to educate them in a nonpartisan way and that you don't conduct political activity. I love the question I got from one of my clinics recently that said, we serve a really rural area. Most of our patients are probably Republicans. What would they think if we are having a press conference with Francesca Hong, who is a Democratic Socialist for governor? And I said, well, can you say how you engaged everyone? Can you show that you are fighting for their rights as patients and as nonpartisan providers of healthcare access? Can you demonstrate that regardless of someone's politics that they should, advocate for better healthcare access? Then you're doing your due diligence as an organization that wants to engage with candidates, and you can kind of explain it to a patient and explain what you're trying to do to help their situation be better. And I always suggest that someone should leave a meeting not knowing what your political affiliation is as an advocate. Now, maybe that's different if you know them, or, I'm on the county board, you might draw particular conclusions about someone who's a local elected official in the Madison area. But unless you're really, really sure that you're on the same page, trying to be as apolitical as possible and not say, oh, those damn Democrats, they're driving me crazy these days, or whatever it is. Just try to keep it focused on the issues and try to make a personal connection with that person. And my favorite question, you know what they say about assumptions, don't you? They make an ass out of everyone. So it's better to not assume anything at all. People running for office do not want to look like idiots, and they often may pretend to know what you're talking about and not, which is why it's really good. And I do this too. I don't always want to say if I don't know something as much as I should. I'm probably going to find out about it offline and come back to you and then show I understand the issue better next time. But ask them those probing questions, like, have you heard about this issue? Has anyone brought this to attention here before? Have you gotten a 101 on this program I'm talking about? Trying to get a gauge on what they actually know and don't know. And boy, in healthcare, we love an acronym and jargon and credentialing language and regulatory, 42 CFR Part 2. Okay, they don't know what that is. I don't even know what that is. It's, the protections for SUD Clinical records. Okay. None of that is important. So you need to drill down into what the program is that you're talking about, how it impacts people, actual humans in the community. And it can be really hard to translate those things for a policymaker when you're doing that every single day. So if you just jot down a few notes about what you're talking about, just check yourself. Where are their acronyms? Where's their jargon? Where's something that a layperson wouldn't understand? How would you talk to a patient about that issue maybe? And then keeping in mind when you're talking to a policymaker or someone running for office, how does this topic impact them? So what is your why? Why should they actually care about it? Maybe it's a big meta reason, but as much as you can, drill that reason down local as much as you can. For example, there's 3 clinics here. We've all got patient wait lists. None of us have enough, psychiatric nurse practitioners to, get folks in for care. So we've got, 10 kiddos on a wait list that won't be able to get seen until, 6 months from now. Try to provide the impact as much as you can. I think that's sometimes hard to do. But try to as much as possible. So asking some of those questions as you get into the conversation. How familiar are you? Have you had a tour of this clinic before? Those sorts of things can really be helpful in kind of laying the groundwork for an effective conversation. Again, assumptions are dangerous. Often where you're just working through a conversation, maybe just establishing yourself as a trusted source of information. You may not get something done the very first meeting, but you want them to know that you are a local subject matter expert on something. They might have more time down the road. They may see a bill come up that they're going to have to vote on. They may need to figure out if there's a real political pothole going on somewhere. And they want to remember that you're someone they can follow up with. Ideally, then, having a shared understanding of the problem. So I love the example about childcare in Wisconsin because this has really borne out in a lot of interesting ways. So policymakers, I would say, along with advocates, have and providers of childcare, I would say, have a shared understanding that there is a lack of affordable, high-quality childcare in the state. I think most people would probably agree with that. But this wasn't even something people were really talking about in the state legislature and that governors were not talking about even 4 years ago. So in 4 years of time, this issue has percolated up so much that now every candidate for governor kind of is required to have a plan on childcare because this has become so much of a beat on that issue in a lot of local communities as a workforce problem and as an affordability problem. So now there is a shared understanding that something about the childcare system is broken, which is a great place to start advocacy because then you get to talking about solutions. But if you don't have a shared understanding that there's a problem, you shouldn't be talking about solutions yet. You need to convince people that there's a problem first. I don't mean convince like lie to them. I just mean get them to pay attention that there's a problem. And then you can talk about what kinds of solutions might there be, because some folks may want to say we should subsidize this entire program and turn it into a social benefit and a public good because, it helps everyone get in the workforce and then kids are better off, et cetera. But Republicans in the legislature may say, well, this is a private sector issue. So really we need to rejigger the ratios on how many kids can be in any childcare setting so that the market works better. This is a free market issue and that there's too much regulation. And those are two very different ways to solve this problem. Maybe they're both valid, maybe they're not. I'm not a childcare expert, but at least then there's discussion about what the different solutions are. And then ideally, once there is a shared understanding of a problem and various solutions on the table, you can work toward finding a path forward on those solutions. And usually it's not 100% of everything. Usually it's a little bit of something where everyone gets 80% of what they like and no one is really happy, but you've slightly, moved the needle on that problem. Whenever I'm talking with a new policymaker, I'm also trying to work through in my mind this spectrum of, do they know about the issue? Do they agree with both the problem and the solution per my last slide? Do they actually care enough about the problem to do something about it? Maybe they do, but it's just sort of peripheral, which is also okay. Not everyone is going to be your champion, tip of the spear on everything. but some people are, and it's important to find those people. And, they say, if you care about everything, you care about nothing, kind of in the policy and lobbying world. So it means figuring out who is willing to fight for that thing on your behalf, who is going to be your back and forth, your go-between, doing the strategy work with you. I would say on that flock camera thing in Dane County, people might have actually seen me as a problem because I really agreed that the flock camera should go, but we needed an alternative for the missing persons cases and issues like that. So I wasn't willing to scrap everything until we had an alternative in place. But then once we figured out the alternative, I was the champion to get all of that moving forward. So, people have different roles as they engage in the process. Okay, let me stop there and see if there were other questions in the chat that we should work through. There were some great examples on some C4 work. Awesome. We talked about having a leave behind of some kind. Oh, and Mary Kay, I see your note on sometimes your actual elected official is just raging on another party. They are working in such a political high stakes environment. That does happen more often than I would like to think. Yeah, if you're not at the table, you're on the menu. I agree. So let's talk about roles, because this gets kind of complicated, and it depends on your own setting and what your role is in that setting and the different ways that different organizations think about this topic. So it's important to know, are you wearing your own personal hat as a citizen of the world and acting in that capacity? So you're not talking on behalf of your organization. You probably want to use more generalized language in a meeting. If you go to like a debate or a candidate forum, you might say you're a local counselor, but maybe not what organization you work for. You're clarifying that you're not speaking on behalf of the organization, and you're using your own time for that work. I don't know about you. I have to keep a timesheet for all of my work. So I would not be putting those activities on my timesheet. My organization is not paying me to do them. On the other hand, if you're wearing your professional hat, that's your top hat on my slide here, you are representing your employer. You've got the permissions to do that. You're talking about your organization and speaking on their behalf. Your organization is also clear that you're doing that. You have a shared understanding, maybe even a policy like was raised earlier about what you can speak to and what formats, with whom, when do you need approvals, and you're using your organization's time, resources, and coordinating that with them. So a few good questions to ask. If you're thinking about getting more engaged with any of this, which I do encourage you to do, either in your personal or professional capacity, is this allowable to do on work time? How much? When? Why? Can I use my work email? Should I use my work email? What about my work phone? And sometimes that's just, is it coming from my work email address or not? Can you use your title, your affiliation with your employer? Are those permissible? It's good to know what your organization's social media policy is. If you're speaking on behalf of your organization, you probably got a whole policy about that. But even as an individual, you might have implications for your organization's social media. I saw, for example, we had some real mess in Dane County not very long ago with Richelle Farms, the Beagle facility, maybe tracking this issue, and an employee of the county kind of went on a rampage on social media on their own private account and said a whole bunch of things about the protesters at that event. And that person, was drawn to the attention of policymakers and advocates, and now has to, answer to their own use of personal social media. So it kind of depends on, what your organization's policy is. So you just want to be aware of that. And then just knowing whether you can speak on the organization's behalf, if so, when, et cetera. And especially for media engagement, like maybe you're going to go to a candidate forum, and there's probably going to be some news people there. What if the news person pulled you aside afterwards and said, hey, you had a really great question about behavioral health. Can I interview you? Who do you work for? Can you take that interview? Can you be on the news, or do you need to say no, thank you? Or can you just say, yeah, I'm a local counselor. I'm not here on behalf of my organization, but I'm really happy to talk about MOUD in our community. I would love to do that, but not as a representative of your organization. You might go to a candidate forum. invite candidates for a visit, identify priorities with them, or maybe you're just doing that one-on-one. Maybe you've got a book club that even wants to meet with someone running for local office or for state, for the state legislature. So there's a lot of different ways to engage. I think I'll move right into, this is just a little bit of context for where we are politically in Wisconsin. We could, it's a rapidly moving environment. But the legislature is not in session now, so it's campaign season. There's no new laws. They're not deliberating on bills or anything. All of that starts in January next year after the November elections. State agencies, though, right now are crafting their budget requests. That'll all go through a highly iterative process over the next 6 months. There is a study committee on artificial intelligence and healthcare. So in case that's something you spend any time thinking about, you could talk to lawmakers about that because it's going to be on their radar. We'll skip that one. June 1st was the deadline for any candidates that are running for state offices to submit all of their paperwork. So now we know who is running in all of those races. August 11th will be the partisan primary. So for example, you have to pick a ballot. So you have to pick a party and you can't cross over. So you can't pick something from the Republicans and something from the Democrats. You have to pick a lane to be in and vote in that. We don't allow crossover voting in Wisconsin. And if you vote in multiples, your ballot is tossed out. So don't do that if you want your vote to count. But for example, Madison's East Side has 5 Democrats that are all running for the seat that Francesca Hong, that one of the candidates for governor, is vacating. So anyone voting in that election and voting in the Democratic ballot will need to pick one of those 5 Democrats, and then that whittles down the field from 5 to 1, and then that one person is on the November ballot. On November, you'll have governor. It'll be Tom Tiffany, the lead Republican candidate, versus someone. There's also attorney general, there's statewide races, but the really, really big question is Republicans have control over both the state Senate and the state assembly right now. I'll show you a little bit more about that, but will that be the same or there will be some major changes? We don't know yet. Also, all 3 of the gentlemen in charge of things in the legislature right now are all retiring or leaving. That is Governor Tony Evers, not running for re-election. The Speaker of the Assembly, Robin Vos, not running for re-election. And the Majority Leader of the State Senate, Devin Lemieux, Sheboygan area, also not running for re-election. So there will be brand new people making a whole bunch of brand new decisions no matter what in the legislature. All of these people are not running for re-election, so there will be also a lot of new faces. But these are how many new people there have been in every election every 2 years. And so even when there's a whole long list of people that are not running for re-election, there's generally only, 15 to 30 new people every year. There will be at least 18 this fall because of all the people that are not running for re-election or running for different seats. But it does mean that even if there were 26 new lawmakers, all the rest of these light blue people are the same. These are people that it is great to build long-term relationships with because they're probably going to be around for a while. There's 132 people total in the state legislature. So this is the first open governor's race since 2010, but there's a lot going on. Number 1, Missy Hughes was out. And then Sarah Rodriguez, campaign finance report, chaos, she's gone. Well, that meant that David Crowley, who did drop out, then he came back in. So he's back in the race now. And then just yesterday, Mandela Barnes dropped out. So after some polling and more financial reports, he decided there's no path of viability. So right now, the candidates are Tom Tiffany. There's also another Republican running, but very new, highly unlikely to make it through the primary. And then David Crowley, Joel Brennan, Kelda Roys, and Francesca Hong. But everyone else is still on ballots. And voters in Wisconsin have already returned more than 100,000 ballots. Those ballots probably include people that are no longer running for election here. So it's really going to be a very interesting race. I'm going out of the country on Sunday, which means I've been holding my ballot till the very last minute to figure out what to do because I want my ballot to count and my vote to matter. Everyone's got a healthcare plan. There's a lot of focus on affordability. So that's definitely kind of a space to work in these days. Many of these candidates are looking for public options, a way to either buy into the state employee health insurance plan or to Medicaid in some way. They have a lot of other differences, but I would share that behavioral health and SUD is not a major area in most of these health plans. So it's really something that we have a great opportunity to inform and put on the radar. People are talking a lot about prices. They're not talking a lot about access. That's the lens I look at a lot of things through. You probably do both and many other issues also. That means it is a great opportunity. We want any of these candidates to say, I wonder what the behavioral health sector needs to be successful, and to have ideas in their pocket. It's our job to help put those ideas forward on the menu of options for them. Here's a little reminder about how much every single vote in Wisconsin matters. Wisconsin's last 2 gubernatorial races were decided by less than 100,000 votes. We've got about 6 million people in Wisconsin. So these are close elections. Your votes really matter. These are the most competitive seats. So if you are in any of these 4 yellow shaded areas, these are going to be the really spicy elections this fall because of the margins in the legislature. So right now, and I am a nonpartisan lobbyist, so I say all of this is just information to inform you. The Republicans have a very narrow majority in the state Senate right now, and the Republicans need to win 2 of these competitive 4 seats to win a majority, to keep a majority, which means Democrats need to win 3 of these competitive 4 seats to take the majority. And several of them are new candidates. So Michelle Skinner is not currently in the legislature. Neither is Jim Croft. So they're running against incumbent Democrats. Jesse James was going to run in this district and then did not. He was a major behavioral health advocate. And then each of these other folks, so Robin Vining is currently in the assembly and she's running for the Senate, sort of the promotional opportunity. Same thing with Jenna Jacobson. She's currently in the assembly. She's running for the Senate, kind of the bigger area, more constituents. So these are the ones that are really the toss-ups. The rest of the seats in Wisconsin State Senate are either safely Republican or safely Democratic, not necessarily because of gerrymandering, but just because where populations live and how they vote. But redistricting is a part of it all too. On the assembly side, these are the 15 most competitive seats. So if you live in any of these, you're definitely going to be getting a lot of ads this fall. But that is a much more wide margin. So there are 99 assembly members and 33 Senate districts. If you ever do the math, that's 3 assembly people to each Senate district. I always think it's fun. The numbers go like this. So assembly seats 1, 2, 3 equal Senate seat 1. Assembly seats 4, 5, 6 equal Senate seat 2. So, they're bucketed according to the numbers in the district. Anyway, so these are the really close races. This is the vote count that decided the difference. Only 1,900 votes. This one, Ben Franklin's seat, 221 votes. The Democrats are coming for Ben Franklin. The Republicans are coming for Steve Doyle. So those are the seats that are tightest, according to the most recent elections. And Democrats need to win 14 of those 15 seats, almost sweep the whole thing to take a majority in the assembly. But it's a wild year in politics, and who knows how any of this is going to unfold. But I think that it will just be a toss-up. I'm not putting any bets on this. I see Marianne's question in the chat. If someone already cast their ballot and the candidate they chose drops out, does that vote still count? That vote still counts for that candidate, even if the candidate is no longer in the race. So you can bet there's a whole bunch of Sarah Rodriguez ballots and Mandela Hong ballots that have already been in there. There was actually just a state Supreme Court ruling about this, and people cannot retract their ballots and vote again. There's no process for that. So those are essentially either not counting, but someone could hypothetically still win, even if they're no longer running. I don't think that's going to happen, but it could technically happen. These are the seats that are currently held by Republicans that the Democrats want to flip. And you can see 2 of them are open seats. Open seats are always more of a toss-up because there's less name recognition of the person. People tend to vote for who they know, even if they don't really know anything about them. If the name is familiar to you, it's a behavioral science. We're more likely to vote for them. And then these are the ones that the Republicans would like to flip and that the Democrats want to keep. As you can see, all of the incumbents of these seats are running again. But this is where the big spending is going to be. And I would say for both of these lists, these are also probably elected officials, both the current Republicans and the current Democrats, that are trying to show their moderate credentials. And behavioral health is certainly a thing that crosses over kind of political lines, something that people probably would be open to discussing with you. So I'll wrap us up with some resources. If you want to explore, we have actually a really accessible state legislature homepage. I'll show you more about that. You can also see bills and what organizations are lobbying on them and what their positions are. My favorite resource of all, which I'll also go through, is My Vote. And you can actually get a list of all of your current elected officials from local government all the way up to Congress and the president, which I always think is really cool because then you can look into these people and see who they are and what their values are. You can also look up your current elected officials in the state legislature and learn much more about them. I'll walk you through that. You can see what kind of bills they work on, what committees they're on, and then it takes you to a homepage and you can kind of learn the way they talk about the issues. And then I'll show you 2 additional resources you're probably not familiar with. One is like an elections hub that's searchable. And then PBS Wisconsin has a great candidate overview too. So before I wrap up my presentation here, I'm just going to share a different home screen with you. And we'll just go through a little bit more of resourcing. So like I said, My Vote is an awesome resource. That should have just come up. So I would suggest starting with what's on my ballot because there's so much going on. It's hard to keep track of everything. So I'll show you how this works for me. And this is an official state website, so it's all very, very accurate, nonpartisan. It's definitely a good website to share with staff, patients, whoever you want. It's a nonpartisan site. So it tells you your next election, and then it shows you you're going to have to pick one. You can only vote in one political party. So let's say this is the Republican ballot. If I was, for example, looking at the Democratic ballot, I would see that all these guys are still on it. You could still vote for them if you want to. And then you've got a few others where there are no partisan, races there. These people will go to the general election. And then some local races too. It's only clerk of court and sheriff for local races. The rest are on the April ballots. So I think this resource is really, really helpful. So that's who's on your ballot. And then my voter info is my other favorite one. Oopsies, wow, you can do the math on hold. I am now. Lucky you. So you can see where your ballot is. I have received my ballot because I need to vote this week. And then you can see people's voting activity. And then at the very bottom, view my current elected officials. These are all of the people that represent you all the way from the president down through state legislative races. You can figure out, okay, Calder Royce is my current state senator. She is also running for governor. And then you can just keep going. So I test to make sure it's accurate. I must be my own elected official. So here I am, proved it. But you'll get school board, county board, etc., which I always think is kind of fun. So on the state legislature page, the first thing to do if you want to find your elected officials, you can put your address in the map, and then they will come up just like that other page did. You won't be able to tell here who's running for office again and who's not. That'll be a different resource I'll show you momentarily. But again, you can find these people who represent you in the state legislature. Oh, it didn't really like my. There we go. Or you can just click on the map and it'll pull up your representatives, your state senator and your assembly representative. And then you can click on this person to get to their website and learn all about them, what they have been up to, what committees they are on, etc. So that is really helpful information here. You can also find all of their other accounts. Maybe they are posting information. Now, again, this is going to be all their official activities. This is not going to be their political accounts, political campaigns. That would be separate. Then finally, I will walk you through, this is something that I have permission to share with you all through an organization that I contract with, but this is an interactive website that has all of the candidates, and the link will be available to you after today. So for example, you can see for state assembly, it's got great information about the area, who's running, what the partisan divide is, who the people are. So let me test one in my neck of the woods. There's a spicier one that I want to do. I gotta zoom. Okay, here we go. So this is the really competitive Democratic primary on the east side of Madison. So you can see these are all the people that are running. And then you can find their website, their Facebook, and these are all of their campaign information. And if you were trying to engage with the campaign, then you could go to their website, find their information, follow them on social media, etc. And they're probably going to be posting information like, oh, I'm having a candidate forum here. Come see me at the coffee place there. Those are great opportunities to engage. And then I said finally, but I have one last resource. So this is the MHAP page. So we have questions for candidates listed here that can help you provide some context if you're engaging with them. And then we also have some one-pagers that have more context on each of these provisions. So I know I have taken us almost right up to 4 o'clock here. I do want to turn it back over to Sita with NAMI. I'll stay online in case there's any other questions that I might be able to answer, but I really want to be thoughtful about your time this afternoon. Know that it's a Friday, and I'll be available for anyone who wants to stay on more. Thank you so much. And thank you for considering engaging with candidates. I'm so excited for you. Happy campaign season.
Thanks so much, Richelle. Let's give her a round of applause. I mean, this was packed with information. Absolutely wonderful. Thank you so much, Richelle. Just a couple of announcements before we go. First of all, hope you feel confident, informed, and motivated to engage your candidates in your area. Again, this session was recorded. Julia will send it out to everybody who registered for this. I wanted you to know that that the Mental Health Action Partnership has a summit. We're planning a summit on October 14th, and just arranging things right now, but information will come out. Watch your email box for that. And then also one of the MHAP member organizations, my organization and Julia's, NAMI, is hosting some NAMI Smarts Advocacy skill training sessions. And these are really great for anybody, but and particularly advocates in the mental health space. So those will be virtual, and Julia is just putting information in the chat to register for those. So with that, thank you, everyone. Thanks again to Richelle. Thank you all for coming. I hope you have a wonderful weekend and engage. We'll see you on the campaign trail.
Thank you.